There is nothing more special than seeing a patient recover. So before I get into the science, I want you to hear from a couple of my patients.
I started having some symptoms about probably 14 years ago. Um, I had a lot of fatigue, strange feeling in my head. Um, Memory was really bad. Um, Needed to rest a lot. And things just started going, just spiraling downward. I got less and less able to work at my job and things like that. But just I started going to the doctor saying, here's all this stuff going on. What do I do? And they sent me through all kinds of neurological testing, psychiatric testing, all sorts of things. Um, I had a really bad anxiety, and so they were trying all different kinds of anxiety pills and all this stuff, and nothing was really working. And so um, I did see a neuro ophthalmologist at one point, and he did what was called light therapy and helped me a little bit. That's why the lenses of my glasses are kind of pinkish purple.
Hence, in
But um, again, it only went so far. And I still just had no energy and just confusion, couldn't plan anything, couldn't get through a day and accomplish much of anything. Um, so I joined a group on Facebook, um, and I it was a brain injury um, group of people that shared their stories and um, that sort of thing. And one day I was on there, and this guy named Scott Bukow came on and said that he was looking for 10 people to participate in his program. And so I decided I needed to talk to this guy. And uh, sure enough, there was some hiccups first getting started and everything. But once we did get started, um, it was probably 2 or 3 weeks. And that strange feeling that I had in my head was gone for the most part. Um, and if I can remember correctly, I think energy was something that I started to gain back fairly quickly. And my ability to spend more time on my feet, talking to people, doing my job, um, I would say it at least doubled. Um, and my ability to sleep better, get more rest, and just feel more like me and function um, was really the main thing that I noticed.
changed.
Yeah, yeah, yeah. Um, I don't know. There's so much. There's just so much, and there were so many symptoms that I can't hardly remember them all because I'm not dealing with so many of them anymore. Um,
Which is so wonderful to hear.
um, yeah, it's a God thing as far as I'm concerned. Um, I believe that this form of medicine is um, more of what God intended for us to do as far as being taken care of ourselves and properly and things like that. And um, it's it's become so easy for me to see that without the proper things going into your body, um, it just seems like eventually things break down and stop working. And I think that was where I was at. And 90% of that is gone.
So, anyways, I was looking through Kim's original report
Mhm.
on like the scores of 1 to 10. 50% improvement walking, 50% improvement sleep, 50% light sensitivity, 50% spasticity, 100% vision, 50% balance, 85% swallowing, attention 60%, anxiety 45%, impulsivity 50%. Wow, 3.5 months. Pretty good.
Yeah, yeah,
Yeah, so I just thought in a few words you can kind of just tell me, how it's been working with me and how Kim's doing and share it with some other people because the more they hear these stories, the more people we can help.
yeah. I just, she called me one day when I was at work and said, Mom, I can walk. And she said she was kneeling down, like genuine. It was like she didn't even have any control over it. All of a sudden, her knee was bending and she started walking better and she just sleeping better and her everything. It's like, and now she's seeing better, you know?
Yeah, that's just
the,
amazing.
those blurry spots are gone. She used to see the color of what she was trying to see, but it was just a blur of whatever that person was wearing or whatever she was looking at. But now the blurs are gone. Now she can see.
That's just phenomenal. Oh, it's so exciting.
You're
Wait,
crying
okay, so wait, so
every
just tell me
month.
that again. So people started noticing a difference,
Yeah,
like a huge difference.
yeah. Like in my eye appointment, like they would always have another person come, you gotta come and look at this. And I like I was intriguing to them because they know what happened to me. So they were always intrigued. And then I guess looking at my eyes and stuff and what they saw on the screen and what they were looking at, they're like, oh, you gotta come look at this. And this is so weird. You gotta look at this. And this last time they're like, "Oh, you got to look at this." I'm like, "Okay, I'm not intriguing." I was,
No, and
I
then
was
you're
like
walking.
experiment. It's
You
weird.
are. You're a miracle. And then tell
Amen.
me about the walking, because last time when you came here, you had improved so much.
Yeah, like my knee, like I mean, it's still kind of weird at times because my knee bends so much. Sometimes it bends. I feel like I'm gonna drop to the floor because I'm like, wait, is it supposed to go down that far? Because is that's normal? Like I guess that's normal. I haven't walked in so long, like because I used to be stiff, you know.
Yeah.
But
Yeah.
like bending, and it's like, oh, okay. Am I gonna fall to the floor? Like it's bending like a normal person,
And her
And,
balance is so much better too.
and
Yes.
your balance is like 50% better.
Oh
I
yeah,
mean,
yeah.
your anxiety, your depression is all gone down. It's
Oh,
just
big
phenomenal.
time, yeah. And my sleep is getting so much better, and like she doesn't feel like she has to walk next to me because she doesn't feel like I'm gonna fall to the floor all the time. It's awesome. It's like I'm a whole new person.
Yeah.
Thank you.
Oh, that's so great to hear.
Yeah, it is
Yeah.
Oh,
really awesome.
And I feel like her eyelids they're better
Yeah,
now. They're
uh,
they're stronger. They're
yeah,
yeah.
you know what? I mean, Kim, I literally just looking at you right now, I wouldn't know you had a TBI. When I first met you and you walked out, I go, she has a
like
TBI.
yeah.
I mean, well, because I'm a
Well,
30
yeah,
year,
'cause
because I went through it, but I
you knew it,
saw it
yeah.
right away. And now I'm like seeing a person with all this energy and spark and life. It's just wonderful.
Yeah. Yeah.
Wow.
Yeah,
Okay.
I feel like a totally different, like I'm living, like totally different. It's crazy. It's like, wow.
Well, that's awesome to hear. What if I told you there was a new way of treating traumatic brain injuries? And what if I told you that maybe it's not all 100% successful, but it has some tremendous science and an ability to do things that nothing else can, and people have returned? What if I told you I am a survivor of a severe traumatic brain injury to where they had to scoop part of my brain back into my head? I've been in functional medicine for 30 years, but after my injury, it was functional neurology, and only a handful of practitioners really understand functional neurology and especially traumatic brain injuries. I was brought back by several different people having been in the industry. And in the last 9 years, I've done hours, weeks, months, years of research to not only improve what brought me back, but to make it as effective as possible. So bear with me because I want to explain to you what your options are, and then what happens and what can be done in functional neurology. Neurologists are phenomenal. They are great diagnosticians. They can do scans, they can understand what's going on. There's certain medications for seizures. They're wonderful at that. They don't have anything at their disposal to rebuild the blood brain barrier. There is no drug to reduce neuroinflammation or seal the gut or clear the 400-mile long microvascular network. Why is that important? I'm going to get to that in a second. But the other option is physical therapy, cognitive behavioral therapy, speech therapy. Wonderful, wonderful things, but very hard to implement if it up here is got the wires fried on the inside. It's very hard to get those different modalities to work because you got to get the brain rebuilt and healed. So, what functional neurology does, or what I do, is I first seal the blood brain barrier. You've probably heard the term leaky gut. We have also a barrier across our brain called the blood brain barrier. When that is broken, which is what happens during a hit or during a traumatic brain injury, we have our body's own immune system and our brain has its own immune system, and they are not supposed to see each other. But this wall comes down, it's broken. So our body's immune system gets into the brain and it doesn't recognize parts of the brain. And then it sees a lot of inflammation, and then we tend to store some different heavy metals there as well. So it goes on the attack. Then the brain's immune system, which is the microglial cells, are either anti-inflammatory and nurturing and helping neurons develop and grow, or pro-inflammatory and cleaning up, damaged and destructive or dying neurons. Well, the body's immune system's attacking. You've had this damage, this injury, and then the brain's immune system starts to go on the attack. So you get this double hit and you create what is very similar to an autoimmune condition by the body's immune system and the brain's immune system. So it is absolutely imperative to seal the blood-brain barrier. There is no medication that I know of that does that, but there are several compounds that do, and over about a 90-day period to sometimes up to 6 months, it can be completely resealed, and those attacks on the brain stop. And at the same time, you reduce the neural inflammation. And if you listen or look at all of the research out there, every mental health condition, every cognitive issue has neural inflammation associated with it. And a TBI is definitely no exception. There's a tremendous amount of neural inflammation. And again, I don't know of any medication that can reduce neural inflammation, but there are compounds like glutathione, sulforaphane, and astaxanthin, and I could go on, that can reduce that neural inflammation. So now we've rebuilt this barrier and we've stopped two immune systems from going crazy. We've reduced the neural inflammation. Then we have a 400-mile microvascular network that feeds oxygen and blood to the brain. That can get clogged up after a brain injury. So you clear that up as well. That's done with vitamin K2, which is known now for its ability to drive calcium into the bones. And so it's arterial calcification that causes heart attacks and strokes. So that can be cleared up with another substance. Then we have the gut-brain axis. So you have to heal the gut. And the gut, if it's unhealthy, and a lot of people with TBIs have very unhealthy guts. So think of it this way. If your brain's on fire, your gut's on fire. If your gut's on fire, your brain's on fire. So you have to fix the gut and recreate the microbiome to where it's healthy. And when it's healthy, it starts to send good positive signals as opposed to not so good signals. Kind of like, hey, don't start attacking. Things are really good. Really nice signals. They're like two teenagers that are madly in love. So if one gets upset, the other one gets very upset. And sometimes teenagers can be a little overreactive, and so can our immune systems. So it's critical to heal up the gut. Not only do we have to heal up the gut, but we have to seal the gut as well. Because even if we heal and fix that blood-brain barrier that I was just talking about, you have toxic substances like lipopolysaccharides that can pass through the gut, and they will pass through the blood-brain barrier, which is supposed to pretty much keep a lot of bad things out. But certain bad things, if your gut isn't sealed, can get in there. And then a lipopolysaccharide triggers the brain's immune system, and then it starts to create the whole inflammatory cycle all over again. So, as a functional neurology, uh, functional medicine practitioner, what I do is I seal the blood-brain barrier. We get blood flow back into the brain through that 400-mile microvascular network. We reduce the neuroinflammation. We heal the gut and we seal the gut. And there's some other things with the gut brain axis. And when you do that, you stop the autoimmune attack and further damage. Many people that have had TBIs get what's called a secondary TBI. And that's really the autoimmune condition where the body's immune system and the brain's immune system starts to attack other parts of the brain. So you stop all of that, you reduce the inflammation, and you heal the gut, and you start to give some of the nutrients that support brain health. And then you start to see neurons being able to grow again, attach it to other neurons, and create neuroplasticity, and to create healthy, nurturing neuronal growth from the brain's immune system. And the gut is sending positive signals to do more of nurturing and growth and positive emotions. So no, not everybody can come back. But being a survivor myself of a severe TBI over the last 9 years, this is the most effective treatment that I know of. And it's been my passion because I've been a patient, I've been an educator to physicians in 23 countries all over the world. And now I have a practice, which is my brain mechanic. My name is Scott. I do free consults every Thursday. You can click on in the description below. I think it has my website. You schedule a free consultation. It's a no pressure free consultation. I want you to have the best information possible. If there's somebody in your area that does something better or can do it better, great. I do telehealth. I have patients in Canada, Australia, New Zealand, and all across the US. And I will work tirelessly to do everything I can for you. And I understand what it's like because I went through it myself. And that's really a different advantage that a lot of people don't have. And the third one is I've been in functional medicine on the manufacturing side, the corporate side, where I spoke for companies that create the compounds. So I'm able to know what is a much better compound, maybe even the same price. One price might even be higher than the other, but I know certain compounds like glutathione, it needs to be in a liposomal form. Magnesium needs to be chelated. Things like vitamin B6, instead of folic acid, it needs to be methyl tetrahydrofolate. Enough of me going on. But the point is, I've got some advantages that a lot of people don't have. I've gone through it, and it was hell, and it's my passion, and I feel like it happened for a reason, and the reason is for me to help other people and to have learned what I've spent 8, 9 years studying tirelessly to understand what brought me back and make it even better. So, Scott, my practice is my brain mechanic. Schedule an appointment, and I can't wait to talk to you. Thanks for your time.